So you've just had your ACL surgery. What information do you need to know to get you back to your day-to-day life or the sports that you love? Today I'll be talking to a doctor and a physiotherapist to find out just that. So people are starting to return to normal life, hopefully eventually going back to the sports that they would usually play. What is the end goal for many and what's the usual timeline?
Timeline for sport, that's an easy answer. Minimum of 9 months. Ideally 12 months if you can. If you return to sport prior to 9 months, the risk of re-injury is high. Right. So yes, we talk about having good strength and the markers that we look for, but just timescale wise, minimum of 9 months, ideally 12 months to play sport. If you're talking about normal activities, well then that varies a lot. But in essence, a full recovery is a year. Yeah. From surgery to full recovery, 12 months.
So if someone isn't in competitive sports, what typically would their timeline be? What goals are they trying to hit?
Timeline's a little bit tricky because it will be dependent on the patient, but what you're looking for is being able to walk naturally without pain, the distances that you want to be able to walk. Going up and down stairs normally. I know it seems like a trivial and a silly thing to think about, but it's really tough post-ACL injury. Just something as simple as walking downstairs, you can be limping. So that's a good marker that we use as well. There shouldn't really be pain long term. So if you're experiencing daily pain, we need to address that. So being able to do normal day-to-day things, kneeling down, squatting down, lifting, just basic activities, those are the things that we'd be looking for.
What potentially could be contributing to that pain if they were experiencing it?
The first thing you always think of is that something's gone wrong with the surgery. Okay. So has there been if you will, a fault in the healing process? Is it that there is a lack of strength around the knee? So it's that at baseline the knee feels okay, but as soon as they go on a 5-mile walk, they get pain. Is that because we've not conditioned the knee well enough to do those goals? There's lots of pain's a complex thing. There's lots of things that can cause it.
Lots of variables.
Exactly.
When thinking about sports, are there any specific ones that are slightly riskier post-ACL operation?
Yes, so I see a lot of patients who have come in after netball injuries, football injuries and rugby. These sports have a lot of twisting and pivoting activities, and there's a lot of force in some of the tackles that are going in. That's why they're higher risk. But the idea of having an ACL reconstruction is to try and get you back into doing the sports that you love. We know that if you build up your muscle strength to a good level that is the same as the other side, and that you give it enough time, the risk of re-rupture is much lower. So there are ways of mitigating some of the risks.
So why do we need that time? Because I remember before you mentioned it can take up to a year. Why can I not get back into sports after 3 months, say?
We use your own graft, usually your hamstrings, to create your new ACL. All we do is put that in the right place. Your body needs to turn that into a new ligament. That takes time. It takes about 3 months for that ligamentization, for that to turn into a ligament. And during that period, if you go back to sports early, you really risk damaging the newly reconstructed ACL. And any subsequent surgery after that is much harder to do. So it's really important to listen to your physiotherapist and give it the right time before you get back to your sport.
For those people that want to get back into exercise post-ACL surgery, post-ACL rehab, what do you say the safest route is for them?
Firstly, be guided by someone. Don't just sort of do things off your own bat. But really you start low intensity, low impact. So gentle range of movement, low impact cardio, static bike, cross trainer, things like that. And then you gradually build up the strengthening. So you don't want to be doing sort of single leg squats straight away, but there are variations of double leg squats that you're doing, and then you build up. Be patient with it. It doesn't happen overnight.
This is definitely the theme, isn't it? Patience is key.
It is the number one thing.
Yeah.
It is a long old recovery. You need to be patient with it. There'll be dips. Yeah. There'll be times where you're really frustrated. There'll be times where you're like, oh, I can't be bothered anymore. Mm-hmm. But if you want to get the most out of your recovery, stick with it. But that does mean being patient.
So talking of recovery, is there any tips that you would give people for their recovery journey?
The quality of what you're doing is key. It's not just about I'm doing loads of squats, I'm doing loads of plyometrics, so I'm automatically means I'm good. Yeah. The quality of how you move is important as well. It's not just being able to squat, or what's the knee doing when you do squat? Yeah. When you do a single leg hop, how is the leg tolerating that impact and load? So yes, when we talk about patience, it automatically feels like you're going to be doing lots of it, and you are, but the quality of it's key. Appropriate recovery between exercise is key as well.
And I can imagine it's taking ego out of the situation as well, because I can imagine if you're working with sports people, they're competitive, there's going to be that element of, no, I can skip that step. Yeah. I'm good at that step.
If you skip a step, regardless of the phase, but if you skip a step early on, you might get away with it there and then, but that's going to have an impact later down the line. If you get complacent with what you're doing and think, no, I'm better than this, or I'm further along, this isn't me, I need to be doing more. Hey, look, you might fluke it. You might get away with it.
Is it worth it?
Not at all. The phases are there for a reason. Yeah. The screening is there for a reason. So it's really important you stick to it, and take ego out of it, and just sort of go, right, this is where I'm at. This is what I need to get right, then move on. Look, you only get one chance to get it right first time. And look, you don't want to be getting to 9 months and you have to then go back and do things that really should have been achieved.
Because that's going to be
months.
way more frustrating.
Exactly.
So be patient, trust the process.
Yeah, try and get it right first time.
Thanks for watching. To get all your information on everything that is ACL, click here.